Welcome back, everybody, for another episode of my show. I still haven't picked a name for it. Actually, I guess Adding Alpha is what we call it now. Today, I'm going to interview Justin Schreiber, who is the founder and CEO of LifeMD. Recently, they changed the name from Conversion Labs to LifeMD to better, represent what the platform is now. So, Justin, why don't you just kind of talk us back? When you first started the company, what year was that?
We started the company in 2016.
And what was the idea behind it? What was the goal to build?
Yeah, so initially I had made an investment in another direct marketing company, which didn't go so well, and a lot of people know about now. I met Stefan through that investment, and he was this brilliant, hardworking, 30-year-old kid. And I kind of developed an obsession just through this investment with the whole online marketing world and the scalability of the business model. And my background was in the traditional healthcare product world, so I had a lot of relationships with really great products, patented and proprietary products. And so I brought Stefan, and the idea initially was to build a platform where I could leverage my relationships in healthcare, in license, patented and proprietary products in very big markets. And Stefan, was essentially build out this platform, a lot of technology and a lot of human capital, to kind of prove out these products that I would bring in, which ones had, strong unit economics and could be scaled, and then to do exactly that, to scale them. So from 2016 to 2019, that's the most important thing to know about the company is, we built a platform that was really focused on just, the acquisition side, the media buying side, building technology. And anytime we'd meet incredible people at affiliate networks, at agencies, anywhere, we would give them some stock and, give them a small cash salary and be like, hey, come on, we're going to build something really big here.
So I know there's a couple different pieces of the business right now. So you have the PDF Simplify business, right? Which I think you guys now, you had was it a minority stake coming into this year, and now you have a majority stake?
Yeah, well, we always had a majority controlling stake in PDF Simply. We initially made a $250,000 investment in that because, I met the founder. I'd followed him for years. I watched him scale a business from a $50 million run rate to practically a $200 million run rate. And, he was in my office one day and he was like, Justin, I see an even bigger opportunity in the PDF world. I don't have any equity. I made this, the founders of this company I'm working for a fortune. And so we backed him. We purchased 51% of PDF Simply for $250,000, extended some additional credit to them over the years. As with every business, not always as easy as you think day one.
Right.
And then recently what we did is we converted our entire debt position in PDF Simply and increased our equity stake to around 86%. And then there's also an earn back for Sean and the other co-founder of the company to earn back some equity based on some pretty meaningful revenue and profitability milestones.
And that company is growing. That piece of the business is growing over 90%, correct?
Yeah, the growth has been incredible. It's a stupid simple business, and I mean that in a good way, right? And you spend $1, you make $4 or $5. Massive market, it's a market that was definitely catalyzed by COVID and people working from home. Look, the growth is incredible. And what we really haven't talked about, but that's interesting, is Sean's now expanding this beyond PDF Simply and building out what he calls a Work Simply platform, where we're going to have a forms business. We're going to have a careers product, a career product alongside of this. It's going to be a suite of products that kind of all address, they're all SaaS products. They're all sold, directly to consumers or businesses. And it's really exciting what Sean's plans to do. And from a growth standpoint, this thing's I think north of a $25 million a year run rate now. And the way the business is growing, I mean, it could easily be north of $100 million a year revenue run rate within 12 months or sooner.
Are you guys going to own the same percentage of these new products as you do with the?
Absolutely. Yeah, it's all part of the same company. It's all part of the same company.
Okay, cool. So now let's talk about the other side of the business, because I think there's a lot of growth there as well. So what are the three main brands that you have on the, do you guys call it DTC? Is that the right word?
Yeah, we call it D2C. I like to call it direct to patient, because it's telemedicine focused, and our kind of internal mantra is putting patients first, and so we like to call it direct to patients. But it's a D2C business. We have three brands. We have LifeMD, which is a men's health brand. We initially launched with an erectile dysfunction offering. We now treat another 10 or 20 conditions in addition to erectile dysfunction.
What are some of those conditions?
One of them, some other sexual health conditions, premature ejaculation is one of them, herpes, cold sores. We offer one-off, episodic primary care, different dermatological things like rashes, bug bites, eczema.
Okay.
If you go to the website, you can see hair loss. We have one or two OTC products for like immune support, but 99.9% of it is telehealth.
Okay. And so
that's definitely our fastest growing brand. In addition to that, we have Schreiber MD, which is our, which was prior to us kind of, focusing on telehealth. Schreiber has a patented OTC product line, for hair loss. So it's a DHT blocking solution that was developed with over 15 years of research by the two founders. Very, very unique product line. And what we've done with that is we've actually added a telehealth component to it. So we're combining a patented over-the-counter product line, which is very popular, with treatment by a provider for hair loss. So, like for instance, the best one of the most interesting we think markets within hair loss is the female hair loss market. A lot of people don't know this. It's actually bigger than the male hair loss market. And in general, right, very few women have had access to a doctor or a dermatologist, to try to, do something about their hair loss. They've really been limited to what they sell at a pharmacy. And so we're offering topical compounded drugs combined with our patented over-the-counter product offering for hair loss. And it's something that we're really excited about. And the initial data since we've launched it has been pretty strong. Still some things to work out, but we think in the long run, it's going to be a great business.
Are you guys the only ones selling these products from Schreiber?
That's correct.
Okay.
So we can only buy the over-the-counter products from us. That business is doing well. Particularly the Amazon side of that business is just taking off. Which is great. We're really talented, young guy running that program, and continue to get great feedback from customers and patients. And that's what excites me, and that's one theme I really like to point out to investors. One of the visions I've always had for this business, for the condition-specific brands that we have, is taking, combining virtual care, right, the ability to see a doctor from your home, with generic drugs, which are very high margin, obviously when it's appropriate and when the doctor feels that's appropriate. Also combining that with patented over-the-counter products, that are complementary. And sometimes people only need the over-the-counter products. Sometimes people don't need the prescription medication. But what you do, when you create this bundle, is you end up with an offering, right, that's very, very proprietary and that people can't get elsewhere, and that they continue to come back to the brand for, over time. And we've done the same thing with our third brand, which is our teledermatology offering. We in-licensed a really exciting over-the-counter technology platform called RestoreC. We're going to be selling that under the LifeMD brand. I think it's 6 to 10 weeks away from being in our fulfillment center. But over $50 million, Jonah, was invested in this platform. People can go to RestoreC's website and look at it. It is an incredible platform. The story behind it and the science is I've seen a lot of skincare products. I've never seen something with, this kind of clinical data, investment in intellectual property, and just kind of even just recognition and by the medical community. It's exceptional. So, we think that's going to be a really big driver and big differentiator behind our teledermatology offering, which in itself is a massive market.
I know a few years ago, I was trying to find a good face cream for myself, and my friend that works at Sephora, but she is sort of a skincare expert. She told me, do not buy anything from the CVS or Walgreens shelves, because that's all just cheap stuff. Like, if you really want high quality skincare, you have to be willing to pay a premium for it. So I never really understood it. And then she asked me to go pull some stuff that I had in my cabinet and read off the ingredients. And she was just cringing as I started reading off the ingredients. So I think people underestimate the junk that's being sold on the shelves to us. And I think they have to appreciate like you said, the clinical data that went into the development of those products.
Yep. Yeah. So look, what I think, Jonah, is, you look at some of these very big conditions, within dermatology, but the simple ones are things like acne, anti-aging. These are just enormous markets. A lot of people are, just like you said, are using junk from an infomercial, or they buy in a pharmacy, which has, very little clinical evidence behind it. Obviously nothing to do with an endorsement from a doctor or a provider. And this is what really excites me about this offering, right? We're going directly to consumer, with medical treatment from, a licensed dermatologist, right, or provider. And we're looking at the patient's issue, and we're saying, hey, like, here's what you should start with. You should start with this over-the-counter product because your condition's not that bad. And if they need a topical compounded drug with that over-the-counter product, we can do that as well. But what's totally different about this from any D2C business we've ever, any of us have ever seen, is that there's a doctor that really cares about the patient and is driving, all of these decisions, right? And that's why the business model is so exciting.
How does it work with telehealth for you guys? Like, let's just say I have a sexual problem, right? And I need to talk to one of your physicians. Do I contact like an 800 number? Do I go to the website and fill out a form? Is my doctor notified? Does my insurance cover it? Is it pay out of pocket? Like, what are all the elements there?
So our business is all cash pay,
Okay.
and that really kind of fits in well with what's happening in our and unfortunately happening within our healthcare system in America, where 60% or more of Americans are on a high deductible health plan. I'm sure most of the people watching this right now have experienced this firsthand, like I have, and you probably have. So again, it's the way this typically works. We run an advertisement and we say, we can treat your erectile dysfunction or a dermatological issue. The patient goes from the TV commercial or the ad on Google or Facebook to our website. They complete a thorough medical intake form. Usually takes 15 or 20 minutes. I like to point out that, the process, and because of the technology and the process that we have, it's more thorough than most people would go through if they went to their family doctor for this. Once they complete that, they upload an ID, and basically they're routed then with our telehealth platform to a doctor or a provider.
And these are all licensed people, correct?
Yeah, of course. Every doctor in our platform is licensed. And we've built a very complex system where we route people once they purchase the medication that they'd like and the consult with the physician. We route them to a doctor that's licensed in their state. So we have some doctors that are licensed in 50 states. We have some doctors that are licensed probably in one state. And so we have a very complicated system where it gets routed to a doctor that's based in their state. Different states have different requirements or each state has different requirements for what's necessary to establish a physician-patient relationship. So in some states, a video call has to be done. In some states, a phone call has to be done. In many states, what happens is an asynchronous consult, which is especially in low risk, conditions like erectile dysfunction. If the patient puts their blood pressure in and answers, all the questions properly, and the physician doesn't need to get clarity on anything, and they also can see with most patients any other drugs that they're on through our system, they can actually write the prescription in most states without actually speaking to the patient.
Gotcha. Okay. So when you look at, and you guys recently reported, did you report Q1 numbers or was it preliminary numbers?
We reported preliminary Q1 numbers.
Okay, which looked really strong. So I think one of the knocks that people try to use against LifeMD is the growth is there, but the sales and marketing expenses are really high. So can you talk to us about, what is your customer acquisition cost? What's the lifetime value of that customer? And then what's the payback on that customer, which would obviously help justify, if you have to pay a lot of money up front to acquire the customer, but the LTV is significantly higher than the CAC, the numbers make sense.
Yeah, I understand. Look, we haven't put out the specifics, Jonah, on this, and neither have any of our competitors.
Yeah, that's fair.
So I don't want to speak in specifics. Here's what we've said that I think should give investors a lot of comfort, right? We've said that our cash on cash return, the day that we get our money back that we spend on acquiring a patient is always within is almost always, maybe there are some very small exceptions depending on a traffic source, but almost always within the first 3 to 4 months, right? At the most. We get a lot of it back even sooner than that. Our goal internally is to see, and I think generally this is where we are. Our goal internally is to see at least a 2 to 1 on all of our acquisition spend within the first year. And we feel really good. I know some other companies in the space have guided that they see a pretty clear 3 to 1 LTV to CAC ratio. I mean, I would say that that's at a minimum. We wouldn't want to be in a business where we weren't seeing at least that. And my belief is that as we expand into new indications where there's a lot less competition, and there are an enormous number of indications that are applicable to D2C telemedicine where there's no competition right now. My goal and my expectation is to see that those unit economics even improving from there. And the last thing that I'll mention is we're planning to launch this summer our concierge care platform, which we're going to be offering under the LifeMD brand. And if you think about how that could impact our unit economics, I mean,
what exactly is that?
What that is
program going to entail?
It's basically going to be a $50 to $150 a month cash pay, concierge and limited primary care offering. So 70 to 80 to 90%, depending on who you talk to, of the things that the average American needs to see a doctor for can be treated in a virtual environment. And so, what we're launching is an offering where, let's just say $50 to $100 a month, a price point that every American can afford. You can now have, a longitudinal relationship with a doctor that begins with probably one of the most extensive thorough physicals you've ever had via FaceTime, lab work, analysis of that lab work, consultation around how to optimize your health, and then just have access to a doctor without all the craziness of, insurance companies.
We're having to wait 2 months to see your doctor.
You don't have to anymore. That's the point. Like if you wake up in the morning and your finger is tingling or your son has an earache, there's just so many things. You need a prescription refill, which by the way, we can probably do if you're on a high deductible plan. We can probably do it. We can definitely do it much more conveniently and probably much less expensive than even going to your pharmacy. All of this stuff we're going to offer to Americans at a price point that they can afford. And I believe that, this is going to dramatically also change the unit economics of the business, because just if you stop and think about it, every day right now we have, just say at least 500 to 1,000 most days, new patients coming through the door for ED, derm stuff, hair loss, whatever, right? And that number is going to keep growing. Maybe in a year, that's a couple thousand new patients a day. I believe that some percentage of those patients, we're going to say, hey, have you had a physical recently? Are you really frustrated with the most likely terrible or non-existent relationship with your doctor? We have an incredible physician that we've vetted that, you can have access to whenever you need, like having a doctor in your family for X number of dollars a month. And that X number of dollars is affordable. And I know that we're going to be able to move some percentage of these patients that come in for a condition-specific treatment over to that long-term, concierge limited primary care model. And if I'm right about that, Jonah, it's completely transformational, not only for the unit economics, but also for the company, right? And also for our patients, right? The reason why I initially started thinking about this is because we want to ultimately help patients. And it's great that we're helping them treat their ED. It's great that we're helping treat them for dermatological issues. But I started thinking, like, we have access to all of these amazing doctors. If we can move patients over to a long-term model, like that's how this company can really have an incredible impact on people's long-term health.
So would patients keep their existing insurance and then add this on as like a,
this
a
is cash pay
concierge service?
This is a cash pay model. People would keep their existing insurance. So, if we integrate with one of the large lab service companies, which we will, let's say we order, blood work, you could still hand your insurance card to that particular company and it'll be reimbursed. But what you're going to pay us for is that, very special relationship with a doctor. And, this type of concierge care relationship is taking off. It's just typically at higher price points. And we believe we can offer a limited offering where, the margins are going to be great for the company, but we can do amazing things for patients using technology at a lower price point than, a lot of these, high-end and unaffordable concierge care offerings.
So about 10 years ago, when I was working in the investment industry, I ran into a guy. He was a concierge doctor for the ultra rich, and he had 5 or 6 clients at a time, and he charged about $50,000 a year. And he was basically available to them 24/7 to answer any questions they needed. Now, this is probably not as robust. I mean, those billionaires, if they were traveling to India, this guy would do all the due diligence and figure out, what vaccines or immunizations they would need before they traveled. So, I mean, it was a different level, but this is sort of the same thing, just on for individuals like myself that want to talk to a doctor a couple times a year about little things. What is this thing on my arm? What is this skin rash or whatever? How do I get it treated without having to make an appointment at the doctor and wait 30 days to see them?
Yep. Yeah, and I mean, Jonah, maybe I could just make one more comment on the unit economics. What really excites me, I mean, I'm very excited to build, what's likely to be a couple $100 million a year business, right, in the near future with these current conditions that we're treating. I mean, I feel really good about that, and I think the unit economics are going to be good, great, maybe incredible. It's tough. It's a little too early to say, right? Remember, we only have really a little over a year of vintage data, so I think it's silly to go out there and make big projections about what your LTV looks like in 3 years when you don't have 3 years of data. What most excites me about this platform and what should excite investors, they need to look at it like, wow, these guys built a business from nothing, virtually nothing, to an $80 million run rate with a fraction of the capital of anybody else in the space. It's $1 trillion, and this comes from GoodRx and other people. When you add up the pharma opportunity, healthcare product world, telehealth, it's $1 trillion TAM, $1 trillion total addressable market. It's the greatest disruption you or I probably anybody, well, maybe people that were here for, the days of when Google and Amazon started, that would be something that's comparable, but I don't believe I'll ever see this type of economic opportunity in front of me again in my life. And I believe that we've built a platform that's demonstrated we could go head to head with some extremely well-financed companies, build an incredible business with a very small amount of capital. And even if the unit economics were poor, which they're not, I still would be excited about it because I'd be like, these guys did this. It's really, what they did with the amount of money that they had was amazing. And there's 1,000 other opportunities out there. And this is going to change the game for pharma, for medical device, for diagnostic companies, for primary care, for concierge care. There's no shortage of places to go, right? To find new markets and new opportunities. And it's also so that's what it's the platform, Jonah, that excites everybody at this company. We love the brands that we're building. We're really proud of what we do for patients every day, but thinking about what this could be in 3 years, 5 years, 10 years, that's why people get excited. That's why people get excited about our peers as well, right? It's not really about, it's really not about the business today. It's about the platform. It's going to disrupt the biggest market that hasn't been disrupted yet, which is the US healthcare system. And we're clearly one of the top contenders to disrupt.
And I assume you guys right now are focused on increasing that ARPU,
I am laser focused on unit economics at the business. I think that we spent I think that the mandate from markets has changed a little bit as well. Whereas last year, I wanted to show incredible growth. And I knew that we were seeing a relatively quick return on our capital. So, we were a little bit more lenient with CPA. We spent a little bit more, but, as the business—
It was probably more competitive last year too, right? As e-commerce was exploding, there was probably more ad dollars going online than ever before.
There was, around the election really drove up, ad costs.
Right.
So that was the big thing for last year. But the bottom line, like, I guess another thing that I want to emphasize is, clearly I think the mandate from investors, is shifting a little bit. And the focus is on, let's see the unit economics. Let's see when you're going to be EBITDA break even. And, so, we obviously are still expecting incredible growth for this year and the years beyond. But, we're going to maintain that amazing growth, but also kind of, really focus on, providing more color around the unit economics, strengthening them. And I think that you're going to see I think that the numbers you're going to see coming out of the company throughout, over the course of this year, my personal opinion, and I'm speculating, I don't think they're going to look anything like, what the fourth quarter looked like.
What, in terms of EBITDA break even, you think next year maybe?
Yeah, so I called my CFO, right? And because I knew this, I was like, hey, what do you think is the conservative way to respond to this question? Our internal models right now, demonstrate if we don't, scale back, don't really focus on, tightening the CPA up. Our internal models predicted that we would be profitable by the end of next year, excluding maybe some non-cash expenses. But the reality is, and the great thing about this business, Jonah, is like we can kind of, we can pull some levers, be a little bit more conservative with the growth, kind of scale back the acquisitions a little bit, and maybe instead of growing 50% a quarter, right, which we might have been able to do if we wanted to burn a couple $1 million a month, we can grow 15 or 20% a quarter, right? Or, and take the burn rate to almost nothing, right? Or maybe take the burn rate to $1 million a quarter. But so I think the reality is, like, for break even, we can do it when we want. It depends a little bit on our ability to access inexpensive growth capital. If we really wanted to do it by the end of this year, I think we could probably do that. But I think the right way for investors to look at it, the conservative way, would be, sometime in 2022.
Okay. No, right now you guys are focused on growth, market share, bringing new products to market, a customer acquisition. So, I get it. A lot of these sorts of growth stocks are being punished right now. Investors have been shying away from the companies that aren't profitable yet, but I think they'll come back in vogue sooner or later when people look at the growth numbers and start to forecast their 2-3 year projections and models. Some of these growth stocks, if they can hit their numbers, they're starting to look really, really cheap at these prices. So anything that we didn't get a chance to cover that you'd like to add before we end this?
No, I appreciate your support, and thanks for having me on to do the interview.
You're very welcome. Come back anytime. Yeah, I guess that's it. Thank you so much, Justin. Appreciate it. And if I ever come down to Puerto Rico, I'll make sure I hit you up.
Okay, thanks very much. Appreciate it.
Take care. Have a good one.
Bye.